Why is RedVive different? What sets it apart? What sets us apart from the standard red light panels? This is a medical grade device, and what that means is the red light bulbs and the near infrared bulbs have very specific wavelengths. If you think about the wavelength as the medicine, the 635, the 670, the 810, the 850, those were specifically chosen because those are the most powerful effectors of the cells. So those specific wavelengths, when they get into our body, when they affect our tissue, they spike energy production, they help with nerve pain control, they increase stem cell counts. There's very specific mechanisms that those specific wavelengths work at, and that's the medicine. So if you think of, say, medicine as an Advil or a specific steroid or a blood pressure medication, the wavelength is the medication. The other part of that, whenever you take a medication, is dose. Right? So you have the medication. So if you take 1 milligram of Advil and the average dose of an Advil is 200 milligrams to 800 milligrams, it's not going to work. That doesn't mean the medicine's bad. It just means you didn't take enough. Right? And so even if you have the right wavelengths, first you have to have the right medicine, and then you have to have the right dose. And to have the right dose, you have, in light therapy, you have to have enough energy. So you have to have a powerful bulb. The LED bulbs, or light emitting diodes, have a specific wavelength, and that wavelength is the medicine. And the wavelengths that have been studied and published on that are the most powerful in affecting healing and the changes that we want to see with our bodies and our health are the 635 wavelength, the 670, 810 nanometer wavelength, and 850 nanometer wavelength. Those are all going to affect the mitochondria, the cytochrome C oxidase, and affect those powerful long-term changes and affect that downstream pathways. And that's what you get with RedVive devices. The highest efficacy, the best wavelengths, concentrated to help your health.